Bismillahirrahmanirrahim. Assalamu alaikum. Sayyid FAROOQ HASAN is back with a brand new episode of Sky is the Limit. Viewers, we have a lot of professional Pakistanis who are serving all over the world. They've made a name for themselves. They've made Pakistan proud. If I talk about the profession of medicine, we have a lot of doctors serving in North America. They formed their own organization by the name of Apna, and they are probably few of the most recognized and renowned doctors, not only in USA but all over the world. Medicine is a very technical profession. We have a lot of doctors here in Pakistan also who are unsung heroes, who've done a lot in this profession, who've made a name for themselves, and they've made Pakistan proud. I am going to introduce one such doctor to you in today's Sky is the Limit. So let's talk to Dr. Sheher Bano Khan. Assalamu alaikum, Dr. Sahaba.
Walaikum salam, sir.
Such a pleasure to be here. Let me just tell you some of the accomplishments of Dr. Sheher Bano. Dr. Sheher Bano basically did her MBBS from Nishtar College, Multan. She basically hails from Multan. And she's currently, in the business of aesthetic line of treatment here in Islamabad. She's a very renowned dermatologist, and she's a member of the American Academy of Aesthetics and a certified member of AAAM. She is also the first female doctor to chair sessions in IMCAS, France, and is also in the faculty of IMCAS. Now, what is IMCAS? We'll ask her because it's a very technical terminology. Besides this, she also holds a master's in aesthetics medicine from Queen Mary University, England. She has also spoken at the Academy of Aesthetic and Medicine, Pakistan Academy of Aesthetics and Dermatology, and is a master trainer for Aptos and Silhouette Soft Thread. Let's have a word with Dr. Sheher Bano. How are you doing, Dr. Sahaba?
Thank you very much, sir, for having me in your show. And it's an honor, honestly. I mean, sitting in front of such a big celebrity and speaking on behalf of my country, this was always a dream for me.
You are very kind, but I must tell you that I am always on the outlook of all such proud Pakistanis who put my country's flag on the top. So I consider one of them, and that's why I'm here today. And you've got a lovely office. I must compliment you first of all.
Yes, it's a pleasant environment.
So this program that we are doing, Sky is the Limit, is basically to highlight all the unsung heroes of Pakistan and all those people who have contributed in one way or the other to the betterment, to the development of Pakistan, or putting Pakistan on the map of the world. So let's start with the fundamentals, with the basics. You hail from Multan.
Yes, sir.
Right? Born and bred in Multan?
In Multan, definitely.
So tell us about your family. How were your early days in Multan? Tell us about the school you went to.
Yeah, you know a little bit about Multanis as well, because we were discussing it.
Yes.
So yes, I was born in Multan, and there is a combination of Multan and Mianwari blood in us. So the parents and the ancestors are from Mianwari. So of course there were a lot of restrictions on the females regarding the studies and for the career and persuasion of their educational activities. That was quite a challenge for us. I studied in a private school, the public school Multan. And after, because I was initially with my friends, those who were having the parents who were the doctors. So since then we had that mindset, because listening from our friends and their achievements, and their parents were the doctors, I had a fascination that I want to do the medical.
Right from childhood?
Right from, I was in class 8. I was very young, and seeing my best friends and their parents, they were the doctors.
Your parents,
no, they are
none of them
non-doctors,
in this profession?
They are basically, my father is a businessman. He has a political background.
Okay.
And my mother is a very simple lady, mashallah. I am very well groomed under her.
And you're the eldest sibling?
No, I'm on the third number. I have two other elder sisters and two brothers.
Politics never inspired you?
Politics, now it is inspiring, but honestly speaking, I don't want to become a part of it in the current situation.
We will talk about that. We'll talk about that. So, okay, so you went to this private school that you're telling us.
Yeah.
How were you in your studies? Were you one of the
very
bright
medium,
students?
no, very medium type of a student who was just getting a passing marks.
Okay, and you were okay with it? And you?
I tried.
No family pressure?
No family pressure at all.
Okay.
No family pressure.
Okay.
So I tried my level best to, you know, come at the first 3 positions, looking at my friends and to deliver my best. But, you know, never stopping what I was doing was one of the spark that I have since I was very young.
Okay.
Keep on doing, keep on doing.
Okay.
Which, you know, which actually pushed me forward not to stop and to do my best.
Okay.
So this was, I think, one of the quality that I must say that I had. Don't stop.
Resilience.
Yes, resilience, absolutely.
Okay.
Yeah.
So, and what about sports? Were you good in sports?
I was not good in sports, but I am now good in sports because I do a little bit of ridings. So yes, I like few sports. Like
but during school days, you
no,
were...
no, not very active. Abhi to kids are so lucky that they have given the opportunity of selecting the sports in their subjects.
They want to go into, yeah.
Because in our time, when we have a very traditional, you know, metric systems, we were not given that much opportunities to select the sports and the subjects.
And I'm sure Multan also at that time wouldn't have been that much advanced or developed.
Not at all. Even up till now, you will see the Multanis are very like
traditional.
Very traditional, and they are not very well exposed. Yes, going to the other countries and other cities, you know, they can come forward, but sitting in the Multan, we have limitations up till now.
And probably that is one of the reasons you established your clinic in Islamabad. Could be. We will talk about that. So tell me one thing. What was your forte? What was your, bright point during school days? So studies, you said you were average.
I was
Sports,
average.
You were not interested in.
To be honest.
So what was your favorite pastime, or what was your, your area of focus?
Well, the favorite pastime was the PTV dramas.
Okay.
And Aqualagin.
Okay.
And these were, and honestly, I think those times were the blessing when the kids were not being exposed to the social media and the tablets and the phones.
Yeah.
When they had a lot of opportunities to play with the siblings, huge families, good joint family system. Many people to play around. You were that much busy all the day, running from here and there, that you sleep so tired. So these were the activities past days then.
Okay.
Not as such specifically, I should say. I was not too much of a book reader type of a person. I used to love reading my own books.
But you were an avid watcher, drama watcher.
Oh, I loved PTV dramas.
And you grew up with them.
That's why I was telling you that I since that time I've been viewing you, and you are as young as I've been starting seeing from that time.
I'm a threat to your business, I'm telling you.
Yeah, you are a threat, maybe. You speak of really good genetics.
That's very kind. So you did your matriculation and you got into pre-medical?
Yeah, pre-medical. I got into pre-medical, and that was again a government college.
Okay.
The degree college for the women.
In Multan?
So in Multan, yes.
Yeah. So you got enough marks to get into a medical college?
Of course, I think I was good at it because I was the last time, the last type of a reader person who could, count on the little bit of time given for the exam preparation, 2 months' time, prepare the exam and appear and get the good marks.
Okay.
So that was a blessing.
You were a crammer, the last one.
Yes, the crammer, absolutely. Okay. So, you hit at the spot to gain the numbers.
Okay. And then how were your college days? Because obviously college is a different phenomenon from school. It's a very disciplined institution,
yes,
the school, and then college you go and you get exposed to a lot of things, and you get independence, and parents treat you like a semi-adult. So how was that experience?
Sir, honestly speaking, at that time, because this time is very much different, I think you are speaking of this time. So at that time when we had a limited opportunities and we knew that these are the stations where we have to reach and we have to pass exams, so we were mentally prepared for everything. Going to the college, having good friends and having a good company, and again I was blessed to have a sister who selected the medical for herself, so I was actually following her footsteps.
Your elder sister? My
elder sister, Iram. So I was comfortable, copying her, I must say, initially.
And
I did not have my mindset.
If
she can do it, reading her highlighted books.
I can do it easily.
I can do it easily. So that was a concept, like seeing it.
Okay.
And when I reached the medical 4th year, I still remember, then I had that spark. Okay, now feeling of becoming a doctor is different.
Okay. So I'm just going to take you back a bit. So after intermediate,
Yeah.
you went to Nishtar
Medical College, that had a high grade. Yeah.
That had so okay. Getting into FSC probably would have been easier, but getting into a medical college, coming on the
Yes.
merit list, nowadays is a very difficult task. I'm sure
Very
it would have been
difficult
difficult in your days also.
Yeah, a lot.
So how, well, like you made it easily, or you really had to?
No, we really have to struggle. To be honest, it's not easy. If you
Okay.
think, if somebody thinks it's a piece of a cake, no, it's not.
It's not.
The medical studies are very demanding. Your energy, your time, you have to leave your social life and put all the efforts for studying and gaining good marks. Because, so we used to have a system of the academies. We go to the academies and we used to prepare our exam. And very thoroughly we used to study at night, at daytime, every time you are
Just
studying.
like CSS or any
Just
other
like
exam.
CSS or any exam that you are appearing in. So it was difficult journey, but my thing was that I have to gain quite a good number of the marks to reach the BDS, not the MBBS. This was I really wished to do, because the mindset of the girls, because I was from a very feudal background, and I was given this thought that you might not be able to do the emergencies or the surgery practice in future because of, you are a girl. You are a female and you have to restrict your times. So the easiest field to select as a doctor will be the BDS, or if you want to get into the MBBS, select the radiology.
Those are the two safe fields.
Safe field for the girls.
Dentistry
This was the thought.
or radiology.
Yes, this was the thought given to us
At that time.
at that time.
Okay. So
Yeah.
you got into medical college, this Nishtar Medical College.
Yeah.
And Nishtar Medical College has a
One of the renowned
History.
the historical,
history.
amazing,
It has produced
amazing.
probably some of the best doctors
Best doctors
in the world.
in the world, and they are famous for their, achievements.
I know.
The Nishtarians.
I think one of Dr. Amjad Shah just got awarded also. Is one of the leading surgeons in United Kingdom right now. I
How
was just
beautiful is
studying
this
his
as a
profile, so-
feeling of being
And
a Nishtarian?
coming from Nishtar, like
yeah, it's a
that was
beautiful
nice.
feeling. Yeah.
So tell us your time in Nishtar Medical College. How was
It was beautiful. It was simple, quite demanding, and we had a group of friends, so it went really well, alhamdulillah. Yes, the difficult times were there as well. When in 3rd year, it was quite difficult to read the pharmacology, and but it went so well, mashallah. I mean, we had a lot of memories with the friends, with the teachers, the best teachers we had. The discipline of Nishtar Medical College, I still remember the focus on each and every student, the way they claim, they proved it. Even for I mean, I won't call myself as a brilliant student, to be honest. For students like me, they have, they focused on us. So we had a great time with the blessed teachers, honestly.
Any time during those 5 years that you thought that maybe I'm in the wrong field, I should be doing something else?
3rd year.
3rd year.
3rd year was the toughest one, when I started crying in front of my parents, and I was
can't
I
do
want
it.
to give up. And the funniest thing that happened to me, that there are few parents who are very strict and tell their kids no, don't give up and keep on doing it. And both of my parents were sitting in front of me and they have given me opportunity. Okay, leave it.
They were okay.
They were okay. Okay, if you want to leave the medical, reaching at 3rd year, doing all the efforts, and they were allowing me to just give up. And that was the funniest thing.
And that would have challenged yourself, inner self.
That challenged me. That challenged my inner self. And then I thought, no. I think they are not able to understand the efforts I have been through. So keep it there. Keep on working. Try. Whether you fail or you pass, but let's try at least. So that was a challenging time for me, the 3rd year, because I felt that I'm at a wrong place. I'll be married to a guy maybe who will not allow me to do the jobs.
So why am I wasting my time?
Why I'm wasting my time? Live a life just like,
Like the others.
sleep, watch TVs, have kids, and that's it.
So, Dr. Sheher Bano, during your Nishtar Medical College days, were you engaged in any extracurricular activities like debates or dramatics, sports, or anything else, or was it just studies?
Sir, interestingly, to be honest, I think these questions are very tricky to ask. The extracurricular activities. Reason is that we were not being offered that much.
You were
Even
just supposed to study.
I mean, we were supposed to study. We felt that we were born to study. So yes, in debates, I used to participate in debates, and that was quite a fun thing for me. Especially, I loved Urdu poetry. I loved it.
Okay.
And in those days, I used to write my own verses as well. But that was quite a time.
Who were you inspired by?
Allama Iqbal, of course, because his poetry had the essence of Quran. So that's why it's still preserved.
And he puts it in such a subtle manner that, you know,
such a beautiful and subtle, and that was a reading and inspirational thing for me. I mean, it never puts you down.
Absolutely.
That's still preserved. If you see all the poetry and every poet, the Allama Iqbal poetry is still preserved because of his thinking.
And you know, a lot of scholars do research on it all over the world. In
All
Germany,
over
the
the
Goethe
world. It's
Institute
so
and all.
deep. It's
Allama
very
Iqbal
deep.
obviously is an institution.
Institution
was
in
an
itself.
institution in himself.
Absolutely.
So you passed your medicine exam and you became an MBBS doctor, and then I think the normal practice is to do a house job for 1 year.
House job, yes, for 1
and then
year.
you have to decide which area you want to specialize in, like
Absolutely.
surgery or
Yeah,
whatever.
yeah.
So you did your house job in Multan?
In Multan, yes, 6 months in Multan, in
Okay.
Nishtar,
Okay.
and the rest of the 6 months in PIMS.
But
in
by now
Islamabad.
you would have been convinced that you are born to be a doctor, and you have
Yeah.
made it through
I
the
have
difficult
made
part,
it,
and now I am
yes.
going to enjoy
Yes.
and I am going to serve humanity by being a doctor, right?
Yeah, a little point I want to add on
Yeah.
here, that when I was doing the house job, and this is maybe a message for all those doctors who are, this is a very tricky situation when you have to select your field.
Yeah.
So I have given myself a time. There were 2 specialities that I really wanted to do. That was a dermatology and the IVF technique, which is in vitro fertilization, which you must be hearing a lot about, the test tube babies.
Yes, yes, yes.
So these 2 fields I really loved. So what I did, I had a attachment with these departments for 1 year before deciding where I have to jump.
Oh, okay.
So for 6 months I worked with the dermatology department, and 6 months I worked with this Medixi to see that which field suits me
Or which field
and
attracts you?
where I can see myself in next few years. So then I decided, like after doing 1 year attachment, that derma is my place, dermatology. This
Derma.
is where I belong.
And not only the traditional derma, but the new cosmetologist
Very much advanced, yes.
avenue.
The
Okay.
aesthetics, yes.
The aesthetics. So then you decided that.
I decided that.
And after that, your house job, then is there a specialization you went for your...
Of course. I joined PIMS,
okay.
and I did my MCPS training. That was 2 years in dermatology specifically. And luckily I got a chance and extend my studies in PIMS again to do my MD training from PIMS. So it was quite an exposure with the dermatology, but unfortunately in dermatology we were not taught how to practice aesthetics, and we do not have even a chapter of aesthetics in our dermatology textbooks.
Okay, okay.
So that was the...
Even till now?
Even till now, sir.
Okay.
Even till now, but now the trends have been changing because there are many medical universities. For example, the Sheher Medical University is launching it now, the Rawalpindi Medical University. So I will be the faculty of Sheher Medical University for teaching the aesthetics.
Okay.
So now they are making up the criteria for those people who are doing the FCPS dermatology, or they want to, or the plastic surgery department, the plastic surgeons who want to learn aesthetics. So they should be given this diploma of aesthetics from these universities. Now the trend have been setting up.
Okay, okay. But for you what worked? What did you do to get this training in cosmetology?
Yes, it was quite an effort for me, to be honest. I tried going to different clinics in Pakistan, the renowned places where I was being hearing that these practices are offering the aesthetic treatments to teach me, but it was in vain, to be honest. So finally I decided to go to London to join the academy, that is Raj Akila. He's a very famous aesthetic physician around the world, to learn aesthetics. From learning aesthetics and then going all around the world in different conferences and meetings, I gained different pearls from different speakers who were very renowned in practicing aesthetics. Because either we deny or we accept, the world is far more faster than us.
Okay, okay.
And now we are trying to reach there. Now we are finally trying to reach where they are, or where they are practicing. Now we can see ourselves at their level.
Yeah.
So to learn, of course, I have to take the help from the international faculty.
And so so you went there and you spent how much time there?
6 months in London. It was Raj Akila. And then later, I mean, there were short courses, not that long, 4 to 5 days courses or 6 to 7.
Okay.
So they used to give you the hands-on training.
Specialization basically.
Specialization, the diplomas basically. I
Yeah.
must say, not a specialization has not yet been introduced in aesthetics.
Okay.
But yes, the Queen Mary is giving the specialization degree, MSc,
Mhm.
the Masters in Aesthetic Medicine. So that was quite an experience.
You went
But,
there also?
No, it was an online. So it was an online course. So for the distant learners, so they provided the online training.
Okay.
Yeah,
okay.
for the exam they used to call you there.
Okay.
Yeah.
So after doing all this, you came back to Multan?
Of course.
Okay. And then did you
Not
start?
Multan actually. When I came to Islamabad, I was married already. So my family is here
Okay.
in Islamabad.
So your husband is
yes,
based
yes,
in
yes,
Islamabad?
in
Okay.
Islamabad, yeah.
So you moved to Islamabad?
Islamabad.
And then when you came back, then you decided to start your own clinic?
My own clinic, yeah. I opened up my clinic with the name of the iPal, but I had a vision that I want to work as a team, not as a sole proprietor
Operator,
or
okay.
the operator for doing the clinic, because I believe, you know Hamid Zaib Saab, so
Yes.
everybody, you know,
You've
everybody,
engaged some of the best professionals in this field.
best professionals in the field, everybody has their own essence of treating the patients.
Mm.
So teamwork give you more standard treatments to help the patients.
Yeah.
It's very important. The
Teamwork
plastic
is
surgery,
important in every field. Actually.
because if the patient has indication of the plastic surgery and you're giving them the indication of the non-plastic surgery treatments, this means you are not doing fair with your patients.
Fair enough. Fair enough.
If the patient needs a very important clinical dermatology attention, and if you're just putting them into the aesthetic medicine, it won't be fair with that patient.
Fair enough. Fair enough.
Right? Despite of me doing the dermatology training, I prefer referring my patients to Dr. Hamid Zaib Saab, because maybe my training in dermatology will be almost, let's say, 7 years, but his experience is 30, 35 years,
Absolutely.
which means he has more weightage than me.
Yeah, I'm sure he
So-
started practicing when you were born. So
Absolutely, when I was born, that's true.
That's true.
I mean, that makes a difference.
But I think medicine is a field whereby you continuously have to study and keep yourself abreast of all the developments that are going on. It's a constantly
yes.
evolving field.
Absolutely,
Right?
It is.
Yeah, there was one time in my life when my father wanted me to become a doctor. And
That's so good to know.
he actually, after my O-levels, he got the forms for pre-medical and all. So I was just consulting a few friends, and then one of my friend's elder brother was doing medicine. So I went to see him, and I saw Grey's Anatomy, the book.
Yeah.
And that was the time I decided, no, I
No.
do not want to become a doctor, because if
That was
that's what you have to
That was
study.
a wrong decision to see
That is
Grey's Anatomy that time.
But anyways, on this lighter note, ladies and gentlemen, we're gonna take a small break. Dr. Sheher Bano, a very, very interesting personality. We are in audience, with her, and we're gonna come. Welcome back to Sky's the Limit. I'm Syed FAROOQ Hassan, and I am in conversation with Dr. Sheher Bano. Dr. Sheher Bano, so we spoke about the time you became a doctor and you came back to Islamabad. Now, I was going through your profile, and you have a lot of a very enlightened profile, I must say that. You've been doing lectures in different institutions all over the world. You're the first female Pakistani doctor to chair sessions in IMCAS, France, and you're also in the faculty of IMCAS. So you have to tell us what IMCAS is.
Yes.
You're a member of the American Academy of Aesthetics. Then you did, obviously from Queen Mary, you did your master's degree. You've been speaking at international forums about this, specialized field of aesthetic plastic surgery. You're also a member of the RA Academy in London. So tell us about, first of all, IMCAS. What is IMCAS? And you're a faculty member there also.
So it's an international medical congress for the aging sciences.
Okay.
And from all over the world, the dermatologists and the plastic surgeons gather in this meeting. So it's one of the busiest meetings in the world.
Okay.
With a lot of delegates, almost 70 speakers from all around the country. And sorry, not the country, from the world.
Okay.
So it's a very important gathering for all of us to learn new things, the new innovations, and for the vendors, because there is a very huge equipments that have been displayed in that meeting, the new innovations that are coming in the aesthetic medicine. So that's quite a training academy for all the new learners and for those who have been trained, and it is basically depend on the research-based medicines on the aesthetics.
Okay.
So it was quite an honor for me, because when I was coming to the IMCAS as an independent speaker, they selected my abstract and they said, we would love to invite you, and this is quite a presentable work that I want to see that how you have given these results.
Mm-hmm.
So I think it's now almost 5 to 7 years that I have been going continuously to the IMCAS Academy.
Mm-hmm.
And after giving a lot of lectures and standing on the international podium and giving your best, they finally have given me the opportunity to become the part of faculty.
Wow.
Yes, which is a big thing.
Okay, and
Yeah.
it's basically gathering of professionals from all over the world.
From all over
so
the
you
world.
must be learning a lot. There must be a lot of exposure also.
A lot of exposure, sir. That's a plastic surgery and all the people who have been doing the aesthetic medicine.
Wow.
So not only the dermatologists are doing the aesthetic medicines, there are other doctors from other professional fields, like from the gynae, from you name it, the GPs, and everybody is doing the aesthetic medicine.
A lot of people now focusing on this field, and there's so much innovation in this field. We're going to talk about those also in the last portion of this program. But obviously, it's a very exciting field, interesting
It's exciting,
field.
yes.
And you've been speaking at different international forums also. So tell us about your experience, your exposure there.
To be honest, being a Pakistani, standing on the international podium and to represent your country is one of the biggest honor when you see the flag with your name, the Pakistani flag. When you see a lot of countries, the India, America, South Africa, Bulgaria, you see every flag on that podium.
Yeah.
And when you see missing your flag, then you have a little bit of agony that why not Pakistanis should stand on that podium. So when they announce me as a Pakistani speaker, so that's a privilege
that
for
makes
me.
you proud,
That's
and that
a
makes the country
privilege.
proud.
That's a privilege. And of course, the exposure of us to learn more about aesthetics, that is a fire that I still have, and that will be in me. I never felt that when I sat on my seat, I'm a full consultant. I have a journey. I will go through the journey and I will learn more. So that's a promise that I have made with myself.
Very nice, very nice.
So,
that's amazing.
Yeah.
You are into doing a lot of social work also. I was just going through a profile. Can you just touch briefly upon the different initiatives or projects that you're doing in that respect?
Well, social work, honestly, I wish to do, to be honest, not into that much. I'm in touch with the PIMS department, oncology department. I'm trying to support those kids who are not...
who cannot financially support themselves
who
for their
cannot
treatment?
financially support themselves for the treatment. And it was a dream to make a EB center in PIMS.
Okay.
Which is, EB is basically the disease of a skin, epidermolysis bullosa, in which the kids have got the blisters on the body, and that's basically the genetic disease.
Okay.
Because of the cousin marriages.
It's not an acquired disease, it's
genetic, yes. It's a genetic, and they have to suffer from this blister all their life. The prognosis, this is the prognosis, and this is quite a bad. Internationally, I see there are multiple places where they have made the EB centers. But in Pakistan, there is not a single EB center. So when I was even getting my training in the MCPS and I was very young, I had that thought of making the EB center in Pakistan. And it was quite nuisance of me to go to and speak to the dean at such a young stage and young age without thinking of my fundings that, sir, I want to make an EB center for the patients who are coming in the dermatology department because I can't see their sufferings. That's in my mind.
Very nice.
And I have my international colleagues as well who definitely who are ready to support me in the research to improve the quality of life of such patients and to make a small center, at least not a big one. But I would love to request those who are watching your program, if they can help us.
Yeah. Okay.
I would love to do that.
And how do they do that? You have a website or something?
Well, no, I have all the contacts.
Okay.
Those who are working in the EB centers internationally, and they are ready to give their branch in Pakistan.
Okay.
So that will be easier, to follow their protocols and the platform which are actually available.
So Dr. Sheher Bano, what about this field that that's cosmetology is a very expensive field also, coming to the economics. Very, very expensive, and a lot of people are now into it. A lot of people from media, a lot of people from other social stratas. But I'm sure there must be some genuine cases also who need surgical, intrusion to get something right, medically, but they would probably not in a position to afford it. So do you have any specific provision for such deserving patients also?
Well, in aesthetics, I think it's basically a want, not a need.
Okay.
To be honest.
Okay.
So when they are coming for the want, and it's all cosmetic.
Yeah.
Yes, for those non-affording patients, and they want our help.
Yeah.
So we do help them, of course.
I was talking about something like probably a crude example would be an acid burnt victim, let's say, and she wants some kind of improvisation. She's gone through the basic treatment, but if she wants some kind of cosmetic,
absolutely. I'm helping such patients.
That's what I was talking about.
I'm helping.
You're helping them.
I'm definitely helping. There are multiple treatments that we offer them, and by maybe giving them, even there are few patients of mine which I'm not charging anything.
Yeah.
Because I really want to help those young patients.
Yeah.
First is that there is a medical intervention for such patients, that skin graft.
Yeah.
Or and then later when they got the skin grafting done, or the flaps done, we do the microneedling treatment or the carboxy treatment that I don't charge for that patients. Those who are non-affording and those who are really deserving.
Yeah, because God has given you a skill, and I'm sure helping others, helping humanity is probably one of the best things that you can do.
This will definitely
yes.
This will add on to your practice rather than
Absolutely, absolutely. Okay, so that's great. So I want you to narrate some interesting incident that happened outside Pakistan when you were representing Pakistan at any forum as a speaker or as a student. Anything that you'd like to mention? Any
interesting things do happen. Like people, the moment you introduce yourself, I'm Pakistani, and are you Pakistani?
Are you from Pakistan?
Are you from Pakistan? I mean, why? Why this is an eye-opening reaction from so many people? Are you from Pakistan? If related to Pakistan, honestly speaking, and then you have to give the impression of your country, that your country is beautiful. Most of the time I just open up the Google and I show them the Hunza, Gilgit, Baltistan, promoting, okay, this is beautiful, this is beautiful. Maybe they think, okay, your country is very strict. Do you allow your girls to work? Oh, that's so strange.
There are a lot of misperceptions.
These are
also
the funny things they ask us. So I think this is a little bit funny for me when they open up the eyes. Oh, are you from Pakistan?
And that's exactly where we need professionals like you to project and portray the true image, the softer image of Pakistan, that we have a lot of talented females here who have excelled in their fields and who are actually teaching the world.
Absolutely,
so that is another service to Pakistan actually.
Being a trainer coming from Pakistan and standing on the international podium and giving the trainings to the doctors in Europe, in Paris, anywhere. It itself is a feeling of pride and honor to be a Pakistani and to be a trainer at such a, maybe I will call myself young because my age in aesthetic medicine is quite less. So I think it itself is an honor for me to represent my country in all the best way that I can.
Absolutely, that's a great feeling. So tell us about the part where you became a trainer.
That was quite a difficult thing because I'm a trainer for the thread lift, which is known as Aptos, and they have their offices in 85 countries and the division in almost 90 countries all around the world. They have their products. So this company was the guy who invented the thread, the first thread. This company has been formulated by them. So they're the family of the plastic surgeons. The criteria to fit in their trainership was quite difficult for me, because they first said that you have to submit 10 cases of before and after. They have to see the perfection in your work and the cleanliness. After submitting the 10 cases, then they invited me to go to the Georgia and to do the live demonstration in front of them. So I still remember there was a hall filled up with the plastic surgeons, and they were observing my way of presentation on a patient. So first they just given me a cadaver, a dead body, I must say, a face, and they said, okay, expose the layers of the skin and explain us. And then they have shown me the model, the plastic model, how you will practice the threads. Then I have to show them my maneuver and the technique. After passing that, finally they entered me into the real OT with the real patient. Now do the hands-on and tell us that how you will do the treatment of this patient. That was quite a journey. I mean, it wasn't a simple thing for me to be selected as a trainer.
But you made it finally.
I made it finally. Yes, I
Mashallah.
proved it that yes, I have a capability to show my best.
Very nice. And that's true Pakistani. So, Dr. Sheher Bano, now coming to your specialized field of cosmetology, you have an institute here in Islamabad. How is it different from so many other institutions which have mushroomed over the last probably couple of years when this field really took off and everyone wanted to be in this field? How is your practice or how is your facility different from those?
So there were many clinics before those who were doing the good work and upgrading very late. I mean, they were having all the equipments and they have been practicing, but they were not upgrading themselves.
They were not keeping up with the times.
Not keeping up with the times. That I felt because on the international meetings when I used to go there and I used to see a lot of new equipments and new technology has been oriented, and that has not yet been introduced in Pakistan. So why not, And that fascinated me that, okay, let me do my best, that wherever they are matching their standards, I have to bring the same standard in Pakistan. Because many people go to the Turkey for getting their aesthetic procedures done, to Dubai. Why? Why not I, process and why I should make my practice to that level where they do not have to leave the country and
they
get
don't
these
have to
procedures.
travel internationally to get that done.
So what I believe, what I'm trying to give in my clinic is the excellence of the procedures, the equipments, which are far more expensive, and technology is very updated. Number one, this. Number two is, of course, the loyalty and the purity of the work that I believe is very important in aesthetics, because I'm repeating again, it's a want, not a need. When you go to any patient, the cardiac patient or any patient who is having the pain, you don't question the doctors. When you go for the beauty, you question the doctors and you need the value for money.
Yeah.
So there, our work stands. Give the maximum, because in our field, every layman is a doctor. They can judge themselves because they can see whatever have been done. So you can't make excuses.
It's visible.
It's visible. You can't make excuses, right? My face sculpting, my body contourings are one of the most famous ones. My equipments, the equipments I have, the machinery I import from all around the world, it's very, very expensive. Technology is very unique, upgraded. And especially I want to highlight the body contouring, because the major problem in our country is again obesity. Obesity, people think might be the cosmetic problem, but it is something which is related to your health. It's an umbrella under which you are going to have stress, hypertension, diabetes, and list of the diseases. So that's the one door that is open for multiple diseases. So in that case, we have introduced the concept of the liposuctions without putting the patient into the general anesthesia, without giving them the hospital stays, walk-in, walk-out procedures with the help of course, the energy-based devices, which are very, very technically sound. Along with that, this clinic will be the first clinic in Pakistan who will be offering the gastric balloons and replacing many of the bariatric surgeries in the future.
Like liposuction and all?
Well, bariatric surgery is different, sir.
Okay.
Liposuction is removing the fat, the stubborn fat from the body. For example, even if you are fit and you have stubborn fat anywhere on the body, then of course the treatment of choice will be liposuction.
And it's invasive.
It is minimally invasive, of course. That's why I'm using the word lunchtime liposuction, because we are the ones who have given up the concept of doing the procedure, come in the clinic, 3-hour procedure, walk out yourself. You don't need hospital stays.
Okay.
So another one is the gastric balloon. There will be a small capsule. The people will drink those capsules. That is not invasive. and the capsule will balloon up in your abdomen, and in almost 1 month's time you're going to see the reduction in the weight, that is 35 to 40 kg, almost 35 almost.
But that's for extremely obese
Extremely
people.
obese patient, those who have a lot of BMI that is above 35.
Okay.
So, but we are opening, and that will be monitored with your smartwatch.
Oh, okay. Okay.
So in
Is
4
it
months,
one of the latest technology?
it is one of the latest technology.
And
That
do
is
we have it in
ellipse.
Pakistan?
Not yet. Not yet.
You will be the first one.
We will be the first
Pioneer.
one. Yes.
Okay. Very nice.
Eluron, and that is Ellipse is the brand.
Okay.
So that is quite an interesting technology, and there are multiple things. I mean, you name it, M-Cella, M-Scalp. These are very technical equipments. I wish I can give more, information about these.
It will become very technical then.
It will become very technical, so we can touch these topics one by one.
Yeah.
If you allow in future, inshallah.
Okay, great. We'll do a separate session for that. And tell me one more thing. So a lot of media people, actors and all would also be, I'm sure, coming
Of course,
to you.
yeah.
And you'd be dealing with so many different people from different stratas of the society. What happens when something goes wrong? You know, like if you treat someone, because as you mentioned before, it's very visible. It's in your face.
Yeah.
So if you do facial treatment for someone, and if it doesn't do well, after 2 days, 3 days, when that person realizes that, something wrong has happened,
Yes.
I'm sure the reaction would not be very
Pleasing.
conducive or pleasing. How do you deal with such patients?
Yeah, one thing that whenever we offer the treatments, we always tell the patient about the downtimes. In 2-3 days, we don't let them judge. Yes, we make sure that we are staying in touch with the patient, holding their hands, that if something goes wrong, then we are the consultants. So aesthetic is becoming too much polluted. I must say that please get a proper training whenever you will be entering into this field, because it's a proper medical field. It's not just cosmetics. Now the salons are offering, without looking at the skin conditions or anything, giving the complications. Consultant is a person who know, if I'm doing this procedure and this will end up into the complication, how to get through the patient from that complication and how to handle it. There is always a way. If I give you a small example, for example, the fillers, for example, the hyaluronic acid filler. Well, you are naturally blessed, so you might not know about these things.
I've never.
So the ladies, or when many patients who have been in touch with the aesthetic treatments, they know what are the fillers, hyaluronic acid fillers. Okay, it's very commonly done in every practice. So the most common complication of hyaluronic acid filler is the blocking of the vessel.
Okay.
God forbid if you block the vessel and you're not treating the patient in 30 minutes or maybe in 70 minutes or 1 hour, the possibility is the tissue necrosis or the vascular occlusion can even lead into the blindness. That's one of the biggest complications.
That's as serious.
It's as serious.
So that's a lesson for all those people who take it very lightly, that we're just going in for a brief procedure.
Yes.
It could be detrimental for your future life.
That's, I'm being very true on the camera, because we have to generate this information to the people. And if you do not reverse the complication on time, the patient might suffer the tissue loss forever. So these are something which is very, very important things which goes in our mind whenever we treat the patients. Alhamdulillah, if I tell you, we have a very good record, because one of the most busiest procedure that I do in my practice is the fillers. It's fillers. People know me, those who are my patients, that in one day we are doing 10 face sculptings a day, which is quite a record. 10 face sculpting means that in one patient we inject almost 10 mils, 7 mils fillers exactly.
Okay.
Yeah, without seeing too much.
And what is your infection rate? Like how many?
Infection rate, honestly speaking, I must say, in liposuctions we have to be very, very careful.
Yeah.
Okay, quite a sterile techniques.
Yeah.
But it's almost near to nil.
Nil.
Yes,
Right.
it's almost. I have not seen that
So you
serious
have
infections.
All satisfied customers.
They can comment on your page. They are welcome to give their feedback.
Okay, so we are now at the tapering end of the interview. Just to sum up, what are the few of the latest techniques or technologies that are being worked upon in your field in cosmetology around the world, which the world would probably be seeing in the near future?
There are multiple things, so this is quite a technical question. I don't
Is it-
know
it
how
is?
to. It's quite a technical question. There are
Okay.
multiple things which will be coming
Just
in the
briefly,
future.
if you can just generically talk about
In-
2 or 3, the top ones.
I think aesthetic medicine is actually something which is related to the beautification field.
Yeah.
So they are bringing a lot of new equipments with the new names, new technology I yet have to see.
Okay. Okay.
Which is something, yes, there are a few big brands who are actually working on the new technologies and the new scientific based, treatments
Yeah.
to prove that this is something which is effective.
Okay.
In plastic surgery, I mean, I heard there will be a complete face replacement.
Okay.
I mean, this is something which is terrible for me to know.
So you can
but
change your face.
You can change your face.
So I can become Tom Cruise.
That's that's the only thing I can tell you. But yes, there are many things that are coming up new. The work on the botulinum, injectables, and the machineries that have been upgraded. And again, that will be, I mean, we will not lag behind as a Pakistanis to bring all these new technologies in future for sure.
Fair enough. Great.
Yeah.
That's awesome. Dr. Sheher Bano, a lot of people, a lot of youngsters, a lot of talented youngster females, budding doctors, who in the medical colleges will be watching you on screen right now. Anything you'd like to say to the youth of Pakistan?
Honestly, work your best and try to select that field which you think suits you. Don't force yourself if you are not fit into that thing. Don't force yourself even to become a doctor.
Okay.
So in whatever field you think that it will suit me, just try to pursue it and don't stop working. Work for the benefit of your people as much as you can, and definitely for your country, because your country need your support.
Yeah.
Don't leave Pakistan.
Wow.
Stay here and make us feel proud about
That's a lovely message.
Our-
Pakistan is our identity, and I
it.
don't
It is.
think we are Pakistan and
Don't
Pakistan
leave.
is
I
us.
mean, many students want to leave Pakistan and
Yeah.
they are doing it.
Yeah.
So just stay with
It's
it.
difficult to stay in a situation and make it right. It is difficult, but it is doable and possible, and that's what shows your mettle.
And we can do it.
That's the
We can
easiest
do it,
way is
yes.
to, if there's a problem, you just leave it and move on. That's the easiest way, but probably not the best of the options. One more thing that I learned after talking with you in so much detail is that you do not necessarily have to be the top 3 student category to make it into a successful Pakistani or a successful practitioner or a professional. Dr. Sheher Bano, as she mentioned, during her school days and college days, she was probably not one of the best students. But
True.
I can assure you that probably she is one of the best in her fields right now. So that shows that resilience. If you are focused, you can achieve anything. Hard work makes all the difference.
Totally agree
With that note, Dr. Sheher Bano, thank you very much for your time. It was
Thank
really
you,
a
sir.
pleasure to be here.
Thank you very much.
Feels
It's an
just
honor
like
for
home.
me.
You've got a very nice energy to your place. And with this, viewers, we come to the end of this episode of Sky's the Limit. Inshallah Ta'ala, I will see you in another exciting episode of Sky's the Limit. Till then, Allah Hafiz.